I recently met with Dr. Geeta Swamy, our Executive Vice Dean for Clinical Sciences and Research Administration, to talk about the progress we've been making in strengthening Duke's research enterprise and how we're positioning ourselves for the future in a changing research funding landscape. Geeta, thanks for joining me today. I think it's an understatement that we've seen an incredible change in the external funding environment, but that's really pushed us to think about how we can do things differently, particularly around efficiency. So what things do you think have had the biggest impact?
So not knowing what was coming, back in 2024, we really started to think about efficiencies and streamlining processes. So we started to think about how to expand and contain our research administration, the people who are our grants managers that work with our faculty every day. And so we streamlined processes, tried to centralize some of the efforts there, and continued that over 2025. That actually positioned us really well to be able to implement processes and procedures, react quickly to policy changes across our entire research portfolio and working with our faculty.
So those are operational changes, and our people have changed as well. What are you seeing in our faculty that's going to have an impact?
Well, as you mentioned, lots of changes. It's been hard for a lot of people, but I've been incredibly impressed by the courage and the creativity that people have exemplified. One of the things that we've seen people do is, sort of pick up and say, okay, I'm going to take on that challenge, right? Instead of saying there aren't great opportunities to submit grants, let me find other places I can submit grants.
Right.
And we've seen even more proposals being submitted than in the previous year.
Yeah, that number has markedly increased.
Yes.
So I think that positions us pretty well, given the fact that the NIH budget actually saw an increase. Now, we haven't seen the effect yet.
Right. We haven't seen the effect yet. The budget increased slightly, right? So we're confident that that will hopefully trickle down to us. The one thing that has happened, though, in this past year, as you know, the NIH Blue Ridge rankings came out and Duke did quite well in that. So that, again, just helps us to know that we're on the right track, right? We've got amazing people doing amazing research, and we need to keep going with that. But we will need to wait and see.
Little patience.
Yes.
But
And
be hopeful.
Be hopeful.
Absolutely. So one thing that we've worked on with campus is our message.
Yes.
As you know, coming out of COVID, there's a remarkable decrease in trust in science. And so they began this narrative called Research Save Lives.
Yes.
Why do you think that's going to be important?
Well, every time I see that logo or see that at an advertisement, it makes me smile.
Yeah.
And then I just think about, why does it make me smile? So you and I have been researchers for our careers, right? But people out there, outside of what we do, don't necessarily understand what that means. Yeah. But it's really about the why and the impact. And so by saying research saves lives and showing those examples, I feel like it helps to demystify that, helps people to feel connected to it instead of thinking it's just some papers people are pushing around or grants they need to fund the work.
We really want everybody to be able to tell their story.
Absolutely. Absolutely.
So people always ask me, like, how are you surviving, or how is Duke surviving? And I always say it's about our people. We have remarkable faculty and staff.
Yes.
That makes me so proud. What makes you proud?
Well, actually, I would probably say a very similar thing.
Yeah.
And I think that I'm incredibly proud of the faculty for really getting through some tough times and then thinking about how to pivot to new areas. Right. How to think about new areas to advance their research. So, if they were studying a certain way to attack a problem, maybe they could figure out using that same way to think about a new problem, right? Or a new method to try to address the same problem they've been studying. With our staff, I have to say, we are continuing to help them feel like their work is important, is how we'll get there together. And I think the Research Save Lives campaign is really helpful for our staff to see. They don't always see the direct impact. And I think it's important for them to understand, too, that the people doing the research have really great stories to tell, and they're part of that.
Yeah, that's a great point. So it's often said that with disruption, and we've seen disruption, there are opportunities.
Yes.
So what are some of the opportunities you're thinking about?
Well, I think technology is really one of the key answers, right? I do think, coming out of COVID, you mentioned 4, right? Things that we learned out of that. We have been able to leverage that remote work opportunity in great ways. I think it's also thinking about ways to do that with research. How do we make sure we can use remote opportunities to conduct research? For example, our family medicine program has a rural health arm.
Good area, yeah.
How do we make sure we're offering research to patients that they're seeing out in different locations, right? I think the same thing is leveraging the technology aspects across the health system and the school together. Lots of things that are created in the health system, like the ambient listening tools.
Yeah.
How can we leverage those things for research? How can we use our research minds to make sure those tools are also used well and leveraged to the same degree we can for patient health?
So we're also thinking there might be some new opportunities in IH as we start to see what the priorities are. Anything that you're seeing that our faculty should be ready for?
Absolutely. So one big area, right, as the government has changed some of their priorities, right, is trying to improve the focus on what we call novel alternative methods, or NAMs. That's our acronym.
Non-animal.
Non-animals, yes, exactly. And, that sounds a little scary when people have been accustomed to doing their research in a specific way. But as we have looked at our research portfolio at Duke, we're actually incredibly well positioned to do that. We have the brain power, we have the courage and the willpower to do it. We just have to now coordinate and organize.
I mean, that's an example where we just have to say to faculty, heads up, this might be coming, and then we can really harness what we have here.
I think that's a key, right? In 2026, we've got to be ready for whatever comes at us. I think that's something I learned from last year.
Well, we're going to end on an optimistic note. We know that the NIH budget has increased.
Yes.
And so we think the floodgates should open.
Right. I'm hopeful in the next couple months that we will see that.
Well, Geeta, thanks to you and to your team for everything that you do.
Thank you, Mary.